holistic approach to safety and health at work after the pandemic of COVID-19 or occupational disease.
Good morning. สวัสดีค่ะ First of all, I'd like to congratulate the organizer to have such big and informative memorial event. And also, it is my great pleasure and privilege to be here to share our experience and our approach and our tools with you. But I'm sorry, I cannot speak Thai. So I will speak English, but I try to be clear. I have the strong accent. I'm Japanese accent. I try my best to speak slowly and also to be clear. But you can stop me or you can raise your hand when you have question. I'm happy to answer. And today, the theme I was given is the holistic approach to safety and health at work after the pandemic of COVID-19. It is very challenging, no? It's very difficult. And I was thinking, what is the holistic approach? Especially for the after the pandemic, it's a big challenge. And so I tried to set a clear goal based on this title and discuss with you what we can do in the holistic approach. So first, we have to think about what did change during and after the pandemic. What did change? Because during the COVID-19 pandemic, we had to focus to prevent the infection, right? And we learn a lot how to prevent the infection at the work, inside and outside the workplace. And also, we have to learn about how to recover well your business, your work, your health, your safety. How can we recover? These 2 points, a big challenge for us. And then, what changed? The work process and organization. When we focus on the prevent infection, what we learn? We have to keep the distance, right? We have to, for example, to keep the distance, we try to reduce the contact with the others. So our work process change. And also, what about the working hour or the workplace? Many of you experience teleworking or the shift work. Some kind of change. That is the work process and organization change. Also, the employment conditions change a lot. Many workers lost their job. Many businesses are closed, right? And some company decided to do the online job. So that kind of employment conditions and a lot of new technology was introduced. In my age, I belong to the older generation, so still I'm a bit difficult to use the mobile phone or the digital tools, but still, obviously, the world of work is changing to the digitalization. And our mindset and our behavior changed, right? I see many of you are still wearing the mask, even though the government released, they changed their policy. Many people wash their hands more frequently, and many of you are still keeping the teleworking or the working from home. As a result, we have so many emerging hazards and risks. It's the physical, biological, ergonomic, chemical, psychosocial. We have so many new emerging hazards we identified at the workplace, and also our occupational risks are changed. And then What did not change? Yes, you can see this kind of traffic at work or the chemical substance. They were hazardous, and after the pandemic, still they are hazardous. So many OSH hazards and risks didn't change. And also, overall OSH legal or the policy framework remains the same. Of course, the government and the social partner modify a little bit the legal and the policy framework, but the overall framework remains the same. And what about the enterprise company? Their OSH system, of course, they added some element, but overall OSH system doesn't change. And what about our own knowledge and the skills on OSH? Yes, we learn a lot about the prevention of COVID-19. We learn a lot about how to prevent the future infection or the other outbreaks. But still, many of us, our OSH capacity or the skills are the same. And very importantly, OSH principle, of course, is always the same, doesn't change. Prevention. OSH is prevention. It doesn't change. Okay, and also, still, we have a lot of loss due to occupational accident and injury. Maybe I showed this slide last year, but I like to emphasize again, every year, almost 3 million people die from occupational accident and disease. And more than 80% of these deaths are due to work-related disease. By the way, there is the one estimation due to the COVID-19 at work, maybe the number of the estimated death is the 60,000. That is the globally, but the 60,000 people lost their life due to COVID-19 infection at work. In addition to that, over 400 million people suffering non-fatal occupational injury. As a result, we lose 5% GDP every year. It's the big loss. But again, I like to repeat, we can prevent this loss if we have the very good OSH control measure. And this is another very recent big development. Last year, the International Labour Organization, we have the fundamental principle and rights at work. These are the original 4 elements: freedom of association, collective bargaining, elimination of child labor, elimination of forced labor, and elimination of discrimination at work. But last year, June 2022, safe and healthy working environment was added to this principle, fundamental principle and right at work. This is the big decision. This is the landmark decision by all member states. At this point, the ILO has the 187 member states, including Thailand, and all delegation, all member states adopted to add occupational safety and health as fundamental rights. What does this mean? Now, all workers, irrespectively their gender, their age, their employment status, or their nationality, or the migrant status, all workers in all workplaces should be protected, should enjoy their rights at work, including safe and healthy working environment. And in addition to that, just I'd like to share with you, you may know that just now, the G7 meetings are ongoing in Japan by the Japan presidency. And the last month, the end of April, labor and employment ministers get together in Japan, Hiroshima, actually. And then they adopted the statement. That is the Kurashiki statement. And in that the statement, they committed occupational safety and health plus well-being of the workers. So you see, we have the global commitment by the global leaders and also the declaration. So we have the very good policy framework at the global level and the national level. So, yes, we need a holistic approach, but how? That is the issue for us. And the ILO has the global strategy on OSH. And this is a little bit older, 20 years old. It's they adopted 2003. But still, even after pandemic, these two pillars are valid. One is the prevention culture, promotion of preventative safety and health culture. Second is the systems approach. That is the management system on OSH. And just to review, what is the management systems approach at the national level? And in another word, is the OSH management system at the national level. You have the very good national OSH system. You have the law and regulation. You have the tripartite advisory body. You have the enforcement compliance system. You have the knowledge management like this OSH. And also you have the national OSH policy. Thailand has the beautiful national OSH policy. And to approach, to achieve to the policy, you have to change. You have to improve your system continuously by the PDCA cycle. Then you need to have the information as profile, and based on the information, you have to have the program. And in fact, Thailand has the very good program, and I believe currently the government and the social partners are working to develop the third national OSH master plan. And it will be covered from 2023 to 2029 is the 5 years master plan. And that is the very good framework to improve your system towards the national OSH policy. And when we see what is the holistic approach after the pandemic, we have to review and we have to add some element what we learn from the pandemic to these items. Maybe you need to review and update your policy. You need to change the system. You need to change the programs, master plan. That is what we have to do. And what about the enterprise, workplace level? It's the same. Each enterprise, each workplace review and update their OSH management system based on updated risk assessment. Now we have to add particular emerging hazards and risks due to pandemic and after pandemic. So we have to reconduct risk assessment. And based on the risk assessment, each company should update their management system, especially emergency and preparedness plan. That is very, very important. Then, suggested action at the national and workplace level, we have a lot. As I said, review and update policy, review and update law and regulations, and targeted risk assessment, promote OSH management system, and the capacity of workers at the management. We have to continue the upgraded training to both workers and employers, and facilitate managers, workers, cooperation. Then, what the ILO can help you? Any assistance? Yes, we have the global call to action, the human-centered recovery. And the OSH is majorly is the protection of all workers. We need to have the integrated approach, not only on OSH, but maybe employment, enterprise development, on any other element of the labor. We have to, going forward, with the integrated approach for the recovery from the pandemic. And also now ILO is working on to develop the new instrument on biological hazards. Last year we published the new technical guidelines. Also, this is the ergonomics, the human factors, and it will be coming to the new instrument in 2 or 3 years from now. And also, this is very critical, mental health. During and after the pandemic, we have so many issues on mental health. And now, the Thai government and the employers and workers recognize the needs to improve the capacity of mental health. And in fact, ILO has the project in Thailand to strengthen the capacity of mental health. So this is my last slide. In summary, yes, we need a holistic approach, but the basic of a holistic approach is the risk assessment and OSH management system. And we have the commitment, the high-level commitment, and we have still developing the new tools. So what we can do next? We work together. I have to learn from you regarding the biological hazards, mental health, ergonomic factors, and we can develop the holistic approach. Thank you very much for your attention.